Good morning, everyone. I'm Mike Skidmore, Ottawa City Commissioner, and we're going to be talking about the COVID-19 crisis here in our county and our community. And with me this morning, I have Dr. Bud Ransom. Dr. Ransom is the Franklin County Health Officer. So welcome, Dr. Ransom. We're glad to have you this morning. Why don't you start us off as an update as to the COVID-19 virus in our county?
Okay. For the past several weeks, we remained fairly steady with not a lot of new cases. And as of last week, we had about 35 new cases. Earlier this week, we had a total, 13 or 14 new cases in the first 3 days this week. That concerned us. However, for the past 2 days, we have not had any increased cases. I think the increased number of cases is partly due to increased testing, but there are also more symptomatic patients. So I think we have to be aware that we may be seeing an increase in number of cases, but I don't think it's alarming or totally unexpected given the relaxation of restrictions over the past 2 or 3 weeks.
With these new cases, Dr. Ransom, I guess it didn't surprise you, but do you foresee our leadership going back to a phase 1 or phase 2 more restrictive measures than we are currently in our phase 3?
That is always a possibility, but I don't anticipate that in the near future. Should the number of cases bloom even greater, then yes, that's a possibility. But as for now, I think the plan is to continue on phase 3 as outlined by the governor in her plan. And we've stayed with that plan, and we'll continue that for at least the next 2 weeks. It can always be changed, either liberalized or become more restrictive, depending on the circumstances.
Okay. And I guess the most important question is, how can we protect ourselves when we go out in the community?
Well, I think everyone knows that social distancing, staying 6 feet apart is important. Good cleanliness, hygiene, hand washing, use of antiseptic hand cleaners, and masks. I really believe that masks are an important part in preventing the spread of the virus.
Just like that, right? Okay, we need to wear them, I guess, I agree with you, we go out in public. But can you tell us a little bit about the longevity of the masks and how often should they be changed or disposed of?
Okay, so there are disposable surgical masks. That's what we use in the office. I wear the same one all day, barring some contamination. But usually 1 day is sufficient. And you probably ought to change it at that point. The cloth masks that people use, I think it's appropriate to wash them after 1 day of use. If they're used for just a few minutes as you go into a store or something, I think it could be used multiple times without washing. I think basically that's it.
Okay. Well, the World Health Organization recently came out mentioning asymptomatic carriers were very unlikely to transmit it to someone else. Then they backpedaled on that and said, well, maybe not that much of a chance, but maybe a greater chance than they first mentioned. What's your take on that?
Okay, so the World Health Organization spokesperson did say that the likelihood was the transmission was very unlikely in asymptomatic persons, and she was referring to a certain segment of persons who are COVID positive who never get sick. They are COVID positive, but they never really experience any significant illness. And it's probably true that those people are less likely to transmit the virus. But it is kind of confusing because there is another population of pre-symptomatic people who have been exposed to the virus they have the virus on board, and they are going to get sick. And in those few days before they get sick, they are highly contagious, and they can spread the virus very easily. They have a large viral load, and they can spread it to people. So we shouldn't assume that an asymptomatic person is not going to spread the virus. I think they certainly can, and those are the people who should be really wearing a mask. They don't know they're sick. They're wearing a mask. They prevent the spread. That's probably the most effective thing we can do to keep them from spreading it to other persons.
Very good. Well, Doctor, now that the summer is upon us and we want to get outside in the sunshine and travel and go to local ball games, how do we protect ourselves differently once we get outside?
I think it is true that being outside is a positive thing. It is less likely to be spread outside as long as we maintain social distancing. We still need to do those same protective things that keep us from transmitting the virus, the hygiene, the masks, and the social distancing. Heat and sunshine probably do help diminish the number of virus on objects and such. So whether that really affects transmission in these group settings that we're going to have in the summer is questionable.
Well, what keeps you up at night, and what concerns do you have going forward?
Well, I'm relatively sure that we will have a surge. When that will happen, how severe it will be, I can't predict that. I think we will we'll have to respond to that as we see what happens. I think we can see some evidence that that's going to happen by what's transpired in the states where they've really relaxed their rules earlier than we did, and they're seeing significant increase in cases. So I think it will happen. I hope we can suppress it by doing the things that we've talked about. And I don't know that I don't sleep at night because of it, because I think we're doing what we can do, and I don't know that there's much else I can do about that.
Good point. Well, any other final comments, Doctor?
No, I just hope people believe that this is real and do those things that are a courtesy to everybody else in order to help prevent this virus from spreading here in this county. Very
good. Well, Dr. thank you for serving as our Franklin County Health Officer. We want to thank our Franklin County leadership and all the medical professionals in fighting this virus. And I really believe together we can beat this thing. And so I do want to tell everybody there's more information on the link where we describe this video to the people. So be sure to check that out at Franklin County. So once again, Dr. Ransom, thank you for your time. And thank you for everyone for watching this, and have a great day.
Thank you, Mike.